So how can I use EMS and apply EMS when patients have orthopedic problems and restrictions? So let's welcome Dr. Bernd Wegener. Thank you very much. And when we talk about EMS and orthopedics, let's first of all take a look at what we have. Last year, we also looked at the current state of play. I gave you an analysis of our database. I entered whole body EMS as a search term. I found 12 articles: sports science, neurology, heart, CK was also mentioned. The only thing that wasn't represented, any type of orthopedics. And then we took a closer look. Maybe we've got the wrong search term we chose. Let's take EMS in connection with any type of back pain. There are 2 studies, but they haven't got anything to do with back pain. So at the end of the day, in a nutshell, no idea what data exists in this topic. Now, it's 2018. We conduct the same search, and we find that there are 7 studies added to the 12 already existing one. 12 plus 7 here is 18. Well, strange enough. But, well, there's one amongst these studies which is highly interesting and published by Professor Kemmler. You just listen to him, and we would like to take a closer look. He described the effect of whole body EMS on patients suffering from back pain. He conducted an analysis, took out a few out of the large pool of test persons suffering from back pain, and in terms of pain intensity and frequency, he compared them with tested persons not suffering from back pains. The bottom line is that in this area, pain intensity and the EMS training subsided. The frequency subsided in both groups. The only thing is the intensity of back pain did then should not show any effect in the group without EMS. So, well, big surprise, nothing happened. So our colleagues concluded that with less time consumption than with usual forms of treatment, we see a positive effect under EMS. But they also see that in this cohort, in this group and methodology, a final conclusive statement regarding back pain is impossible, and further studies have to follow suit. Now let's go back to the history of electronic therapy. Many years ago, we found animal-related effects that were electrical effects. There were the first medical applications with gout and headache. And well, I feel sorry for this fish because I'm a diver myself. Then for hundreds of years there was nothing on this particular topic until in the 18th century we had a further then work on pain and they focused on this pain field. It continued with the manufacturing, the construction of equipment. People knew how to use and generate electricity and use it for their purposes, and there were funny treatments when only people could do this to people. Human beings would never do it to each other. Such cages were actually built up, and the Russians at one time started to use this technology and transpose it into sports, and they were talking about tremendous success rates. Then the medical field was also included in the early 20th century with a little work. I want to have a maximum of effect on my muscles and the love handles, etc. on your bodies, but there was also an impact on pain therapy, the use of electrical pulses on the nervous system. The intention was to suppress pain impulses, and for this we've got various applications up to electric acupuncture. We're talking about electrotherapy. We've different forms of applications. Well, we have got then a direct current, deontophoresis. 2 electrodes are being applied. On the one, you've got your medication, and due to the direct current, you penetrate the body. Usually the skin is there to prevent just that. In this case, it works pretty well. And then in the low frequency range, that is below 1 kilohertz, we've got 2 forms of applications. The TENS therapy, transcutaneous electro nerve stimulation. It's about pain therapy in the first place, and relatively close to where we are, and this is the EMS, electromyostimulation. Medium frequency ranges are used for treating back pain and strains. What happens? There is more blood pumped through the veins that warms, activates the tissue, then triggers a metabolism to bring about a positive effect. High frequency applications mainly work via direct heat generation. And now let's turn to my major topic. That's back pain. When we look at back pain as a global topic, there are hundreds of terms that come to mind. They are really confusing up there in your heads. Nobody knows what they actually, how to distinguish between it. There's no system, to it. When we transfer it to clinical everyday life, we have got an anamnesis, come up with a diagnosis, we apply medication, get one or the other injection. There are smaller, larger scale surgeries, and at one particular time we come to the limb of the spinal column surgery part, and we then stiffen the column when everything is fine. Well, it's not good because many of these patients suffer from a chronic pain, not due to our surgery, but despite our surgery. They come with a problem that cannot only be treated by performing surgery, and so we have to include other processes and procedures, and we tackle the issue of pain therapy. So now let's come back to the question of how back pain occurs. Well, there are scolioses, deformations and rotations in the spinal columns. There are degenerative changes. This is the biggest part of it. And whatever comes in for EMS treatment, well, this is the best for EMS. And what you should keep away from is inflammatory disorders and diseases and traumatic the illnesses. What is interesting is spinal column pain-inducing illnesses that do not have any structural relation to the spinal column. So let's say there's a human being coming to see you, talking about his or her pain with different qualities of pain we talk about. We've got acute pain, severe pain, restricting people's mobility. This is not really suitable for EMS therapy, and chronic pain seems to be more suitable for EMS. We talk about local pain, radicular pain, and these structures may also be accompanied by analogous pain patterns. And then when you take this pain and patients, mark the level of pain and tell you where the pain occurs, they have plenty of areas, even outside the body. It's not so trivial to deal with the pain. So in medical terms, there is a clinical examination to start with. We've got the red flags and yellow flags. They are highly important, and I would like to elaborate on them. And then you need some sort of imagery. You say, well, there is a problem. This person is suitable for training, or this person needs medical treatment. Red red flags, as the name well indicates, is something dangerous. It might be a trauma, it might be a trauma which explains it. And we've got aging populations on the other hand side that have got low-level traumas, osteoporosis, and they might not respond well to EMS training. Tumor infections or intervertebral disc-related diseases are not well parts that sort of respond to EMS training. And now the part that makes this area interesting to EMS training, that's the yellow flags. What you have to understand is that back pain doesn't necessarily have anything to do with the back. When you are suffering from pain, you perceive yourselves and the environment differently, and this impacts on our life. This is what's reflected by the yellow flags. There's a strong evidence, a strong scientific proof for depressing situations, for catastrophizing, that there's hopelessness amongst patients, and also passive pain behavior, wanting to avoid pain, evade pain, not accepting it. We have then also the active tackling of pain and a propensity to turn pain into a physical problem. This is not necessarily a conscious development. So back pain, I said before, don't always have something to do with back pain. And here the doctor has to come in and the therapist countering back pain. I've got a number of diseases that can cause back pain, not only a pregnancy, and we had that when we x-rayed that we found that a woman is pregnant, or cardiac, a wrist may be there. Well, it's one area. This is the main order that comes in. You might have this picture here. It's dramatic. People complain about strange pain, and a little later they are dead because this particular balloon bursts, and then there is an uncontrolled flow of blood into the abdominal region. And here I've got the lumbar spine. There is nothing conspicuous, but when you see here, there are calcareous, harmless looking shadows, and this is what you have to see, because when you miss this out, you should talk to your liability insurance, because they are the aneurysms and they make life risky. I talked about the cardiac coronaries. Women suffering from coronaries, they often suffer from back pain. It's not only the heart that hurts, so it's also a criterion you have to bear in mind. And then our society gets older and older. There are also young people suffering from illnesses you have to bear in mind, and of course this is not suitable for EMS therapy. When we talk about back pain, there is one piece of guideline, the national guideline for back pain, nearly 100 pages. If you are more interested, you can get the long version, 400 pages. But what does this particular piece of work tell us? When we are looking for a therapy against back pain, they call for mobility, movements, everything that they come up with has got to do with motion, with exercise. And then there is medication, ibuprofen and Voltaren, that have an impact, but it's not suitable for long-term therapy. And when we talk about opiates, we have to stop administering them quickly, because otherwise they lose their impact. So what is the core statement of this guideline? It's movement, consisting of coordination, strength and endurance. And this is what we have to train one way or another. And we started examining this field in a study. We treated back pain patients by administering EMS. Back pain is an economic problem. Everybody knows it. It costs money to treat people. We asked ourselves whether there is a difference in the parameters we apply to back pain and non-back pain patients. So we took the back pain patients and subdivided them into two groups. Those trained by means of EMS applications and those that underwent classical theory back pain program they went through. We examined it in a large-scale setup. The training program is close to what we know from a physiotherapeutic treatment and our expectations in this field. The evaluation of the results give us the 5 scores here, which are evaluated for rating and assessing pain intensity, quality of life, depression. All of that was then scrutinized, but we also came up with performance parameters. The set of stairs gives information on how quickly and safely can people move up, and then this wobbling board, you know, from coordination training and the fitness studio, and well, people are standing on this platform and they jump, or based on the floor response forces, you can then determine the performance of the spinal column. The results were highly impressive. We could detect that both physical impairments clearly improved and pain subsided. The depressive aspects also decreased, and these are the aspects that are characteristic of back pain, even though we only, in inverted commas, trained people. Our statement was that all scores improved, that EMS training does seem to have a positive impact on back pain, but it's only half time during our study period. We have included about 50 patients currently, and well, a funny thing I can tell you is we heard about risks and dangers associated with EMS training in terms of creating kinase. Well, 3 of the test persons became pregnant. One of the therapists became pregnant. This seems to have a positive aspect. I wasn't very happy with that, surely. So we don't have the results of the control group. We cannot only say, well, is the EMS training not only efficient, but even maybe better than classical training. And now orthopedics includes a little bit more than back pain, indeed. And so rehabilitation comes in here. I showed you the literature, and there is not a lot. Many of the athletes use it, but there's not a lot of scientific data. We do detect training effects. Quite obvious. Why not use it? We conducted a study where EMS training was applied to ice hockey players in lower classes. We formed 2 particular groups, and halfway they changed. One was then the subject to EMS training, one not, and then we switched. We studied various parameters. We mapped it this way here. The shot speed, strength and measurement was also conducted. We took a look at the speed of the ice hockey players, jumping force, speed, and the results told us that the jumping force of the EMS training group this year were increased considerably, and with the group that didn't train, and then in the other group, it's this area here. Well, there we didn't see a considerable effect on even a decrease in performance after the training had finished. And so this indicates that maybe a 3 months training doesn't do the trick, but that you should continue with the training. The same applies to sprint times. The athlete's speed increased. The distance was covered more swiftly than shot speed. There was no major substantial effect, and this didn't take us by surprise, actually. because there is a lot more coming in than raw force and power we are able to train anyway. But when we measured strength, we could see an impact. For example, upper thigh muscles, both in terms of explosive force and maximum force, we saw an increase when EMS training was applied. Then jumping as a parameter, we can also see an increase here, the crossover design I mentioned before. Here, this group trained and had a break up there, and this group didn't train, and then as of here, and well, they have got a clear increase in performance that was achieved. Now, when we think about what we accomplished, we can look at it from two different perspectives. The pure value, the value as such that was enhanced. And as an athlete, when you think about when for the last time you enhanced one parameter of your athletic performance, the last time you have to go back far, because this is quite an achievement. The top athlete doesn't achieve that. You shouldn't labor under these illusions, but in mass sports, these effects are feasible, and so progress is possible. Initially, I said that we've got two different performance levels we included. Two lower leagues of the ice hockey players. In both leagues, we find evidence for these effects. This is a method, this is a type of training which is suitable for mass sports and not only for the top athlete making an attempt at Olympic gold. So our conclusion is the following. Well, there are not plenty of hard scientific facts regarding EMS and back pain, but we really do see a positive impact, and I'm certain that once we complete our studies, the data will be the same as now at half time. And for the first time, we can find evidence for a really beneficial effect. Never forget that, how shall I put it? It's not only the common causes which exist for back pain. There are a few exotic causes you should have on your radar. When you train people and something strange seems to be associated with this back pain, just consult a doctor, who can then say, okay, the EMS training is okay. And when we talk about sports and rehabilitation, we in our area can say that this is a procedure which can accomplish an enhancement in people's performance, and the dangers, the critical moments addressed by Mr. Kemmler half an hour ago is something you shouldn't view too critically. I do not see any substantial problems. Use it, apply it, be a daredevil. You will be rewarded by positive effects. And thank you very much for your attention.